Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today I'm going to be going over when we should be performing an ankle brachial pulse index. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. So what is an ankle brachial index, okay, or ankle brachial pulse index? It can be referred to as either. But it is a diagnostic test to determine the patency of blood flow of the lower limb vessels, okay? So we compare our leg arteries to our arm arteries to see if there's any significant disease going on there. So peripheral arterial disease. Okay, so why do we do it? Once again, to see if there's peripheral arterial disease. We do this a lot of times in wound care if a patient has a chronic wound on their leg, okay? I always, whenever, because I deal with a lot of chronic wounds. So when dealing with one, if there is a leg wound, we should be doing an ankle brachial index. Why? Because we want to properly care for the wound. Now, if it's a venous wound, this means that the blood flow isn't going back up to the heart properly. But if it's arterial, the blood flow isn't coming down to the toes properly. So it's two different treatments, okay? Two completely different treatments. If we have arterial and we compress it, the blood flow can't get to the toes well already, and then we're compressing it more. We're at higher risk of causing those toes to go necrotic, okay? Because the blood flow is just not getting there. So we're cutting off circulation to those toes. Now, if we have venous disease and we compress the legs, it's going to allow the blood flow to go back up to the heart. That's what we want. But we have to do an ankle brachial index to ensure we're treating wounds properly. So when would we perform an ABPI? So yes, with chronic wounds, but there is also times that we use an ABPI with other risk factors because, like I always say, prevention over cure. Okay, we want to prevent things from happening. So if we can catch things early, do preventative measures to prevent these complications from happening, it's so much easier. So risk factors that we would do these for: chronic cigarette smoking, obesity, persistent elevated blood pressure, high cholesterol, and if you're above 50 years of age. Okay. Now there are two components to an ABPI. There's quantitative and qualitative. Okay, so there is the ratio between systolic blood pressures, so the upper arm to the ankle, and analyzing the actual waveform through the Doppler, okay, because you have biphasic, triphasic, monophasic, and they give us different ideas of what's going on with the arteries of the legs, okay? If you want to learn more about how we actually perform the ABPI, I have another video just linked up above here, okay? And I'll also link it into the description below. Okay, so the actual procedure itself, it's really a straightforward procedure. It's non-invasive. It should be painless. If there is any pain, it should just be discontinued. We're not there to cause pain in any way. And I would have other concerns with that anyways. But if there's any pain, like there really shouldn't be. So the test would be stopped. It doesn't require any special preparation. You should wear loose fitting, comfortable clothing because you are going to have to lay down for 10 minutes. And you'll have to roll up your sleeves up to about here so we can get the blood pressure cuff on. So wearing a t-shirt is perfect because we don't want the shirts to compress the arms either, okay? So we want to make sure that we're getting a proper reading. So loose fitted clothing is a plus because we have to take blood pressure from both the arms and both the legs. So skinny jeans, probably not a good idea either. We need to roll up the pants. We don't want them to compress either, okay? We use a Doppler device to hear the waveforms, but it's pretty straightforward of a test. So interpreting an ABPI, I'm not going to go in depth on this video. Like I said, check out the link in the description. I have a little bit more in depth. I mean, I'm not teaching you how to do an ABPI because it does need to be done by a trained professional to properly do this. It does take a lot of practice, not something that you can just do. So it's not something I'm actually teaching, but I do go more in depth over the numbers, all that stuff in my other video. So you can check that out in the description. But really interpreting it, we're comparing our systolic blood pressure from our arms to our legs, and then doing a calculation and seeing where they fall on the chart. Around 1, the number should be around 1. And that's a normal ABPI, okay? So the ankle brachial index testing, so vascular testing devices. ABPI has been around for a very long time, since the 1950s, to determine, and it's super important to determine limb perfusion, but there are other tests that can be done also. So they can do like vascular studies, skin perfusion pressures, transcutaneous oxygen levels. Like there's other testing that can be involved, and not just the ABPI. So even though the ankle brachial pulse index does give effective measurements, sometimes we should not be using this test, okay? So we're going to avoid doing this if somebody is in a lot of pain in their legs, okay? If they're at high risk for deep vein thrombosis, or they are suspected of having one, we do not want to do this. We do not want to dislodge a clot and cause an embolism, okay? This also goes for those who have stents put in their legs. We do not want to compress their leg and dislodge anything, okay? So just super, super careful, making sure you ask these questions. And then if we have painful, slow healing wounds to the lower legs, if they are super painful and compression is kind of going to interfere or touch near that area, we wouldn't do it because it's going to cause them too much pain. So we would have to go on to other testing. Now, limitations of the ABI test. It's not going to give us the exact location of the narrowing. Okay, we're going to know that there's narrowing, but whenever we suspect peripheral arterial disease, we need to make a referral to a vascular surgeon. Okay, that's the main thing I want you to get out of this. We need to be getting them a referral for further testing. Okay. So that's all I have for this video. I hope it did give you a better understanding of the ankle brachial pulse index, and I hope to see you guys in my next video. Bye, guys.